Good afternoon, ladies and gentlemen, and welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would now like to turn the meeting over to Mr. Stephen Sammis, Vice President of Programs at the Canadian Foundation for Healthcare Improvement. Please go ahead, Mr. Sammis.
Thank you. Hello and welcome to today's informational call on the Harkness Fellowships in Healthcare Policy and Practice. Today we'll be talking about the upcoming call for applications for the 2016-17 Harkness Fellowships. As you heard, I'm Stephen Sammis, Vice President of Programs here at CFHI, and I'm pleased to be your host for today's call. As I introduce our speakers, please take a moment to introduce yourselves in the chat box, who you are, where you're from, as well as any questions you might have for today's speakers. I'd first like to introduce Dr. Fiona Clement, who is Director of Health Technology Assessment Unit at the University of Calgary. Dr. Clement completed her PhD in Health Services Research with a specialization in Health Economics at the University of Calgary. Additionally, she completed a postdoctoral fellowship at the University of Newcastle in the UK, supported by CHSRF and Alberta Innovates Health Solutions. Her research interests include health technology assessment, methods to achieve optimal use of technology, and drug policy during reimbursement decision-making processes and system cost containment measures. She's also been instrumental in building the capacity to understand and use HTA by developing training programs for Alberta Health and Alberta Health Services staff and mentoring the next generation of health economists. Dr. Clement was a 2014-15 Commonwealth Fund Canadian Foundation for Healthcare Improvement Harkness Fellow, where she conducted research at the University of California, San Francisco Medical Center. Also joining us today is Mr. Scott Robertson, who is Senior Project Manager for the Medical Travel Program in the Northwest Territories, Department of Health and Social Services. Mr. Robertson played a pivotal role in CFHI's chronic disease management collaboration with the NWT and is developing programming for other CFHI initiatives, particularly the Northern and Remote Collaboration. He has extensive operational policy and econometric experience to support healthcare improvement in northern and remote areas of Canada. He too was a 2014-15 Commonwealth Fund CFHI Harkness Fellow, where he conducted research at the Stanford Clinical Excellence Research Center, and Scott remains there throughout this fall. He has a master's degree in health economics and policy and was previously the Chief Nursing Officer for the NWT. He is also a past Action Canada Fellow. And we also have here our on-call producers Kelly Ripley and Sheena Powell working behind the scenes in Ottawa. On today's call, we're going to start with an introduction to the Harkness Fellowships, including an overview of the program's core components and learning opportunities, as well as to help you understand the specific role CFHI plays in supporting the Canadian Harkness Fellow. We'll also hear from both Mr. Robertson and Dr. Clement about their recent personal experience in the program, including an overview of their research and what they gained from their Harkness experience. Finally, we'll look at the upcoming dates and requirements for submission to help you assess your readiness to apply for the next fellowship intake. For those who may not be familiar, the Canadian Foundation for Healthcare Improvement is dedicated to working with healthcare organizations to accelerate healthcare improvement for Canadians. We support the spread of healthcare innovations across the country. And in 2014, we worked closely with healthcare providers, governments, policymakers, and other leaders to bring about real improvements in the quality and efficiency of patient care, as well as spread innovations in healthcare delivery across the country. Originally established in 1925, the Harkness Fellowships were modeled after the Rhodes Scholarships, and they aimed to produce the next generation of health policy leaders across 9 participating countries, which you can see listed through the visual on the right. The fellowships offer a unique opportunity for promising mid-career professionals, academic researchers, government policymakers, clinical leaders, senior hospital managers, and journalists, for example, to spend a year in the United States to study healthcare delivery system reforms, issues such as bundled payments and other payment reforms, the development of accountable care organizations and the difference they're making in care and cost, innovative approaches to care for high-need, high-cost patients, and critical issues on the health policy agenda germane to both the United States and Canada. The Commonwealth Fund's principal area of interest include a focus on improving health insurance and coverage, which is still an issue in the United States, access to care, and improving the quality and efficiency of healthcare services. And those latter issues are very relevant to Canada. You will see these areas of interest woven throughout many of the Harkness Fellows projects, including both Dr. Clement and Scott Robertson's work in the U.S. Since 2001, CFHI has been working in partnership with the Commonwealth Fund to bring a Canadian perspective to the Harkness Fellowship Program. And in 2012, we began to fund a full-time Canadian Harkness Fellow. Previous to that, the Harkness Fellows were not situated in the United States for the full year. They went back and forth and traveled back and forth between Canada and the United States. But since 2012, Canadians have been fully embedded into the Harkness program. And since 2001, 27 Canadians from across the country have received Harkness Fellowships and have gone on to significantly impact healthcare policy and research post-fellowship through their work in Canada. As we'll hear more from our guest speakers today, the Harkness Fellowship provides a number of opportunities to accelerate professional and personal growth and career opportunities back home. As a fellow, you can expect to spend 12 months at a U.S. organizational placement, and you can see on the slide some of the examples of past placements of Canadian fellows. You'll conduct research on a key healthcare delivery or policy issue and develop in-depth cross-national knowledge and expertise of the U.S. Canadian healthcare systems. You'll also have the opportunity to learn about healthcare systems of many other countries through participating in the program and the peer-to-peer exchange that happens amongst fellows from various countries. You can also expect to work closely with leading U.S. health policy experts and senior policymakers and develop networks of valuable contacts for ongoing cross-national exchange and collaboration. And through your placement, you can expect to enhance your research and methodological skills through the development of your project. For many, the highlights of the fellowships are really around the scheduled learning opportunities through various policy briefings, symposia, workshops, and seminars scheduled throughout the year. A few of the many learning opportunities include an orientation for all new fellows in New York City at the Fund, and an international symposium on healthcare policy in November in Washington, D.C., a 4-day policy briefing on Capitol Hill in Washington that looks at critical issues on the political agenda in the U.S., and the program concludes with a final reporting seminar in New York City where fellows present their project findings to the Commonwealth Fund, their mentors, their cross-country sponsors, and other healthcare leaders. So who should apply? The Harkness Fellowship is ideally suited to applicants who are Canadian citizens or have permanent residency status and have lived in Canada for at least 3 years. For people who show significant promise as a policy-oriented health services researcher or practitioner, have demonstrated expertise in health policy issues and a track record of informing health policy through research, policy analysis, health services, clinical leadership, or writing in the case of, say, a journalist. Have a master's degree or a doctorate or the equivalent thereof in health services, health policy research, or a related discipline. So what does the award cover? As mentioned earlier, CFHI co-funds a Canadian Harkness Fellowship, providing support of up to $120,000 US, while the Harkness Fellowship Award through the Commonwealth Fund provides a further $119,000 US in support to help cover costs related to travel to the US, a living allowance, funds to support project-related work, and travel throughout the program, as well as excellent health insurance coverage in the United States and the coverage of state taxes. For fellows with spouses and children, a family supplement is also available, which is up to $60,000 US. So that gives you an overview of the program. I'd now like to turn it over to Scott Robertson and then to Fiona Clement, who will both provide an overview of their own Harkness experience to help those on the call today gain a better understanding of what's entailed in this unique 12-month program. Following the presentations, we'll look at the upcoming dates and requirements for the application. Then we'll open it up to you, the audience, for questions. So I'd now like to turn it over to Scott Robertson. Scott.
Thanks, Stephen, and hello to all of our Canadian colleagues joining us across the country. It's really a pleasure to be speaking with you. As Stephen mentioned, I am still in San Francisco continuing on my research work here at the Clinical Excellence Research Center at Stanford University. I'm going to give you a bit of an overview of the research I conducted this last year, talk a bit about my experience and what's next for me in my career path. My area of interest, particularly being from the Northwest Territories, was around continuity of provider. There is good research that shows that if you see the same provider over time, the same doctor in particular, you have better health outcomes. This is usually attributed in the research to the provider having a better knowledge of the patient, and by seeing that patient over time, is able to tailor more appropriate care, which leads to better health outcomes. I say this is completely false. You cannot have a healthcare provider who has average or even below average quality metrics and yet is able to produce above average results. So I wanted to dig behind this and figure out what was it about the continuity of providers, seeing that same provider over time, that really made a difference in someone's care, and how do you design that piece into a healthcare system. I was fortunate to be paired with two different projects. One was at the Stanford University Clinical Excellence Research Center in a project called America's Most Valuable Care. We used data to identify high-performing practices, those practices across the U.S. that performed above average on cost and quality measures, so better quality care at a lower price compared to their peers. We then investigated them to find out what they were doing that was different, to see if we could come to some idea about how they were managing to do this. On a more quantitative side, I worked with the Kaiser Permanente Division of Research with a large data set to look at medication adherence rates amongst patients with diabetes to see what were the factors that impacted whether or not they took their medication. Previous research also showed that seeing the same provider over time led to increased medication adherence rates. Unfortunately, today I don't have time to go into too much detail about all my methodology, but I'm going to give you a summary of my findings, which are, your doctor doesn't matter. Don't get me wrong, doctors do matter, but in the research I conducted, it clearly showed that seeing the same provider wasn't really the key element. The element was access to care. High-performing practices consistently were doing three things. First, teaching patients the basics, especially about their medication, and identifying and removing barriers that were preventing them from accessing their medication, such as identifying generic medications they could take or changing medications that were covered by their insurance plan. The second thing was explaining the flashing yellow lights, giving them concrete examples of warning signs they should look for and when they should contact the practice. For example, in cardiology practices, patients were told if they had any shortness of breath, any at all, to call the practice immediately. They would then speak with a nurse practitioner who would discuss their symptoms over the phone, provide intervention, or advise them to come in to be seen to the practice immediately. And the third and most important element was providing that rapid access to care, providing care over the phone, and getting patients seen in the clinic either that day or the next day. These were very common themes that were seen across all high-performing practices. How this relates to having the same provider over time is, I postulate that is more of a proxy for access to care. If you have a good relationship with a provider, you're likely going to be less hesitant to contact them when you have mild symptoms, and you also know how to access care. From a policy standpoint, this is very important because you cannot design a healthcare system around individual providers. You can't make their care dependent on them, because then if your care depends on that relationship, as soon as your general practitioner goes on maternity leave, or as soon as you take a job in a different town, then your whole healthcare system falls apart. So from a policy standpoint, it's important for us to understand how these elements work and to design our healthcare system so that access to care is designed appropriately and patients know when and how to access that care. As I mentioned, there were a number of sites that I visited across the United States, and that was on top of the number of seminars and policy briefings that you will attend as a Harkness Fellow. You have about 8 specific events that you will attend during your Harkness year. As Stephen mentioned, some of them in New York, in Washington. There are some other conferences that you'll attend around the country. And on top of that, I did an additional 10 site visits in relation to my research and also attended a number of conferences. So in the 12-month period of my Harkness year, I was on 74 flights as a passenger. I don't even remember how many miles I traveled, but I can tell you. And that was on top of flights that I did in my own airplane. Some of those were also research-related. But you are traveling a fair bit. And I'm going to talk a bit about this in a couple of minutes around some of the considerations and the logistics of your move. But the piece that I would also suggest you consider is that when you do travel, adding on a day or two to see things while you're there is always a bit of fun. So, for example, when I was in South Carolina, one of my colleagues from graduate school lived nearby, so I spent an extra day to go and visit him. I was traveling from San Francisco to Los Angeles to go to a conference and took a detour via Honolulu. I know it seemed a little bit out of the way, but it was only a couple $100 extra. So I made a couple days of vacation on top of the conference. As with any good story, mine also starts with, it was a dark and stormy night. Well, actually, it was a gray and almost snowy evening in South Carolina when I was going on a site visit. The site visits consisted of myself as well as a clinical expert in the practice that we were investigating, and this happened to be a nephrology practice. And for whatever reason, the email communication with my clinical expert was a bit tense. I wasn't sure why, but we didn't seem to be getting along well. We had a 3-hour drive in each direction, plus 3 days on site, and I was anxious about spending that much time together. I arrived just before he did, so I went and picked up the rental car and picked him up from the airport, and we soon were getting along fine. During the drive, we were telling each other our backgrounds, our life stories, and he informed me that he was, for 10 years, the editor-in-chief of the New England Journal of Medicine. I still, to this day, don't know how to describe that overwhelming, almost starstruck feeling I had, but it was one of those moments in the Harkness year, so certainly not the only one, where I realized how well connected this program is and the people that you meet, the big thinkers, the people who are very influential in policy, in research, in publication, in the healthcare world. So now I had 3 days with one of the most influential people in healthcare publishing in the world, and we got along great. We had a really great time. I got to learn the ins and outs of writing manuscripts and what editors look for, and some really interesting behind-the-scenes stories about what was going on at the New England Journal during his time. The nice circle to that story is he was on campus yesterday at Stanford, and I dropped by to see him to say hello, and I said, do you know this other clinical expert? He hasn't gotten back to me yet on reviewing the abstract for the nephrology article we want to write about our findings in investigating nephrology practices. He said, oh yes, I know him quite well. Let me give him a call and sort of give him a little prod to see if he can get back to you quicker, because I know you're on a timeline. And then he said, where are you planning to publish? And I told him the journal that we are targeting. He said, oh, I know the editor very well. Let me get in touch with him and make an introduction so that when he gets your manuscript, you're not an unknown person. Because I think the research you guys are doing here is very interesting, and I think you'll want to look at it. In fact, I'm going to look at your abstract as well and give you some feedback. But I'd also like to talk to you about where you might want to consider publishing about your broader findings to have higher impact. So that was a very, I'm not an academic by background, but nonetheless, for me, that was that was a really, really big event to have those contacts. And like I said, that's just one example of the type of people that you meet to be able to have that influence and networking on your work and on your career. The question is often, why does comparative research matter? Why can't we just stay at home and read the New England Journal of Medicine about all of these findings? I'm going to steal Fiona Clement's expression about it's very easy to navel gaze. It's very easy to look inward and to pick and choose how you want to compare yourself. And in Canada, we are very good at comparing ourselves to the U.S. and saying everything here is better. And I think that's a little bit short-sighted. It's a very different experience when you are immersed in the comparator site, when you are within it, not only experiencing it from a research side, but when you are meeting the people and the players within it, and also when you have to experience the healthcare system yourself. For example, when you fall and bend your finger and have to find care in the middle of the night, it gives you a very unique perspective as well. What's also unique about the United States is understanding the different levers that are in place. In my time working in the Northwest Territories, my ability to influence was largely based on writing policy. We wanted to change something, we wrote a policy about it, and we try to get people to adhere to that. Whereas in the United States, policy levers are not quite as easy to enact, but payments and quality measures are. So seeing how those have influenced the shaping of their system and how they're able to use those to influence change gives you some very good ideas about what you can be doing back home and in other healthcare systems. I'm going to talk just briefly about the process of uprooting your life. For us, it was a bit of a unique experience because not only were we moving ourselves and our vehicle, but I was also moving my small airplane. So I flew my plane down to San Francisco. There I am flying over the Golden Gate Bridge on arrival. Then I went back up to Yellowknife, and we spent 11 days driving down to San Francisco. We had previously lived overseas and had rented out our house before, and we decided to sell our house this time rather than to rent it out, and sold pretty much all of our worldly belongings. If it didn't fit in the back of the RAV4, it got sold at the garage sale. That was a bit of an interesting experience when all of your, the things that you've held on to for all your life get sold off for 55 cents. The part about if you're going to sell your house or rent it, about taking leave from work, those are really fairly straightforward things. They require some thought. But where I would really encourage you to give some very good thought and have some good discussion is if you're coming with family, if you're coming with a spouse, about what they're going to do for the year. My husband was incredibly supportive. He was very excited about this opportunity, and he used it as a time to work on his MBA, and he also got a work permit in the U.S. and has been working part-time. As a Canadian, if you come on the type of visa, which is a J1 visa, your spouse, if you're legally married, they get a J2 visa, and they can apply for a work permit in the United States, and they can work in any field. It is unrestricted as long as your visa is valid. The process takes a few months to get back the permit. It's about 3 or 4 months, and it costs about $400, but it's otherwise fairly straightforward. As I mentioned earlier, even if you are just doing the basic amount of traveling in the Harkness program, you're away from home a lot. And making sure that you have that conversation with your family is very important to make sure that they're going to be well connected and have things to do when you're away. If you don't know of the website already, meetup.com, it's an excellent resource to find local groups and activities. So when we moved here, we joined, we were involved with a flying group that gets together once a week and then does a flying event every month. We joined a hiking group that does hikes every couple of weeks. We went to a couple of mini putt and bowling events just to meet people and get out and do that. And then when you're traveling, then your partner has something else to do and other people to do it with. The other fortunate part for me is I was one of 4 Harkness Fellows placed in the Bay Area, and there are some of us there in the photo. And if you have the luxury of being close to another Harkness Fellow, use them as your family, because they really were during my stay. And Barry and Fiona, who are there in the picture there, were great. My great local family. I would bike out to their place on a regular basis and hang out with them and their kids, and we'd go to the beach or go for dinner. This is a group of us going out on a camping trip together. So I'd really encourage you to use your Harkness family if you have that opportunity, and if you don't, It's important, especially for your family and for your spouse, to be able to have some connections, because you will be gone frequently, and connecting them is the biggest piece of advice I would give. So the overall lessons that I've learned about the U.S. healthcare system. We are fortunate in Canada, the simplicity of a single payer model, because payment here is ridiculously complex. I visited some healthcare organizations where they had over 50, that's 50 contracts, just with lab companies to do lab work for them. So it's figuring out who pays what your co-pays are for this, how people get reimbursed. It's very interesting, but it's also very complex compared to what we're used to. There's no shortage of treatments. If you want to refer yourself to a cardiologist because you're having a little bit of chest pain, you can. You don't need to go through a GP. That's also a very different thing than we're used to back in Canada. On the good side of things, though, they do have good access to care, as long as you can afford it, and they've got very good use of electronic health records. They put in some good incentives, and people are fairly well connected. The data systems don't always talk to each other, but overall, the availability of data is quite good, and that is really important when you're doing research and you want access to data sets. It's fairly easy to get. And the other piece, and I think this is probably the biggest lesson learned and the piece that I would like to really focus on in my future work in Canada in health policy, is the examples of top of role, top of license for all nursing staff, nurse practitioners, physician assistants, and medical assistants, and how they were being innovative and unique in utilizing these roles to make sure that they could maximize patient access and maximize the utilization of other providers. I'll just leave you with a quick discussion about the career path. For me, I wasn't sure what I was going to do next. I was very torn about the decision to stay here at Stanford, but I was invited to stay on with the research team for another year. That was a difficult opportunity to pass up, so I decided to leave my job in the Northwest Territories for the time being and stay on here. As for what's next after that, I'm not entirely sure, but I will tell you that not a lot of people know the name Scott Robertson, but most people know one of either the Commonwealth Fund, Kaiser Permanente, or Stanford University. And when that's on your CV, it really makes a difference. And even since completing the Harkness Fellowship, I've been contacted by a recruiter who was put in touch with me through the Commonwealth Fund for an opportunity, as well as when I was looking for other opportunities around the Bay Area. I had a number of research institutes that were very eager to work with me because they knew who I was through the networks that I had. They were able to make introductions. So not only does the Commonwealth Fund itself have a very excellent reputation in health research, but the network that it connects you to really puts you in touch with some great people and opens up your opportunities. On average, I believe there's about one Harkness Fellow a year who ends up staying in the United States additionally, and I've been fortunate that the two previous fellows who stayed in the U.S. were both also at Stanford, and I got to work with them over the last couple of years, and one of them I still work with now. And most fellows, when they return to their home countries, within 6 months, change positions or advance within their organization. And I can see why, because the experience really broadens your horizons, pushes your thinking, and really makes you ask yourself and consider, how do you have a bigger impact with your knowledge, with your skills, with your expertise? And often when you go back to your original position, you really want to push yourself to grow out of that. So that's my experience in talking with others and with both in my current year and in previous years. So I feel like I've gone over my time. I'm happy to answer questions at the end of the conversation, but I'm going to turn it back over now to Dr. Fiona Clement, my colleague from this year and good friend, to tell you about her year as a Harkness Fellow. Fiona.
Thank you, Scott. So thank you, everyone, for allowing me to share my reflections today, and thank you to Stephen and CFHI and Commonwealth Fund for making the last year possible for me. So I think my title really sums up how I've reflected on my year. It really was a mind-blowing year for me. I use other words like profound transformation, incredible aha moments about myself. So for me, it really was life-changing, and not just for me, but for my husband and my kids. So I'm going to start just by telling you a little bit about me, where I come from, and why I decided to pursue this opportunity. So I am a very proud mama of 3 young kids. So my kids are 6, 5, and 4. So they were all a year younger than that when we pursued this opportunity. And I do have a husband as well. I should have added in there that I'm a wife. So my 3 kids, when Scott was speaking about the hurdles of moving a family and some of the stress that can be associated with that, that was definitely forefront on my husband and I's mind when we decided to pursue this opportunity. And I will tell you that it went so much smoother than I could ever imagined was possible. So whilst it was daunting, and there's a long list of things to sort out when you're moving a family, it was totally manageable, and I have absolutely no regrets about it. And my kids were so happy down in San Francisco, and they're also very happy to be home. I am a traditionally trained academic, so my path has been PhD, and then a postdoc abroad, and then came home to Calgary to accept my faculty position. And when I decided to go for the Harkness Fellowship, I was only 3 years into my faculty position. So that language of mid-career, for somebody who's thinking about that in maybe a CIHR language, is not quite right. So 3 years, I would still consider myself early career, but I think my timing was probably about right. So don't let that mid-career label steer you off, even if you are kind of usually thought of yourself as more early career. I have dabbled in policy development, so I am an academic, so most of my work has been in the ivory tower silo. But with working with the Health Technology Assessment Unit here at the University of Calgary, Health Technology Assessment is a policy tool. And so I had to adapt very quickly about how to take that very strong technical research and apply it in a policy context. It's something that I am not good at and recognize I really wanted to develop my skills in that, and that was part of the attraction of the Harkness Fellowship. Really the moment where I decided that I was absolutely sure I wanted to try something a little bit different was I was feeling a little bit bored generally with my academic agenda, feeling a little bit like I was kind of just a rat running through a mill and doing the same things and not really achieving anything different. But the aha moment for me came when I was sitting around a table and there were some policymakers and some researchers there, and we were talking about how to solve a problem. And I realized that the conversation was going nowhere. Nobody had any new ideas. Nobody was really thinking about anything creatively. We were kind of putting forward the same ideas that had been put forward in Canadian healthcare about 15 years ago, were not getting us to where we wanted to be. And so I knew that I had to kind of shake it up big and challenge myself to think about things very differently. And that's really the moment where I knew I wanted to start looking for a different opportunity for the next year for my career. And then quite serendipitously, I also had beer with one of my mentors that night, and he is a former Harkness Fellow, now at UBC. He did his Harkness Fellowship when he was in the UK. And he has often spoken about the fellowship being a pivot point in his career, and he thinks about his life kind of before and after the Harkness, and how much that Harkness influenced his ability to achieve impact, hold his ground in the policy world, and really shift his career from a technical health economist to a respected health policy expert. And that has really spoken to me a lot, and so that's kind of, again, why I decided to go for the Harkness. So what did I do while I was down there? So I've already told you a little bit that my day job here as an academic revolves around health technology assessment, which is really about helping decision makers understand evidence and thinking about evidence across a variety of different kinds of evidence to help them make policy. So some of you may recognize this image from a Canadian great thinker, John Leavis. And so I was really good at the green boxes, so I knew a lot about doing systematic reviews. I knew a lot about kind of synthesizing evidence of a variety of different kinds, but I don't know anything about the circles. So that kind of, how do you synthesize all of this and somehow weigh it in your mind and make a judgment about what the right thing to do is and come up with a well-informed health policy decision. So I decided that's what I wanted to learn about. And I'm a quantitative researcher by training, and so I wanted to challenge myself with some new methodologies. So I broke into qualitative research, which for my mind was a big challenge. So I did a case study design. I had 4 different case studies, and I did a combination of kind of direct observation, document review, interviews, and I looked at the national program, so Medicare and the Center for Medicare Services, and then 3 high-performing state programs that incorporated evidence into their decision-making processes, specifically around kind of non-drugs. And so what I found is that many of the same themes kind of came out at all of these, and they're echoed in Canada as well. So that also spoke to me that there is a huge space for collaborative research agenda in my area, crossing borders, to be tackling many of these issues together. So some of them, just to kind of give you a flavor of the things that I'm thinking about now that I'm home, are the incorporation of a patient voice into an evidence base. Everybody focuses on evidence and then kind of throws the decision over the implementation fence and hopes that someone just magically knows what to do with it. And it's something that we're not good at here in Canada, and they're also struggling within the States. Issues of ongoing sustained capacity. So there aren't enough people to answer all the questions that need to be answered. How could we overcome that? Are there ways we could work together? Is there some areas of duplication that if we were collaborating in a more meaningful way, we could actually not duplicate each other's work? And then also there's this major divide between the haves and the have-nots. So in Canada, there's a few provinces that have very well-developed evidence-informed policy machinery, and the other provinces are just kind of flailing around trying to figure out how they can do it. In the States, it's exactly the same thing. There's a few states that are really leading the way here, and the majority of the states are still struggling to find their feet. So again, how can we take those lessons from these early adopters and the leaders and help those that are struggling to kind of come forward and enhance and build on their ability to create evidence-informed policy? So if you haven't kind of got the flavor of that from what I've been saying, it was a very exciting year. It challenged me a lot as a researcher and my mind, and it challenged me a lot to think about where I want to go next in a research agenda, what collaborations I want to be building, who I need to be working with, how I can think about this differently than the way I've thought about it thus far, and how I can really contribute to the Canadian community here. So the effects are, I'm home. I'm back at the University of Calgary in my position. And I was a little bit worried about coming home to kind of the same academic institution and the same people. And it has all been in my mind. It's been amazing. People have been so interested in hearing about what I've been doing, or so interested in hearing about some new ideas. And the environment in Alberta particularly, and in Canada more generally, is just, there's an appetite for change here now. So it's very exciting. I'm inspired. I feel very renewed. I've got a lot of new energy to come back to. My experience also reaffirmed for me my deep commitment to Canadian healthcare. So whilst I enjoyed learning a lot about the States, I am firmly committed to the equity principle that Canada has in their healthcare system, and living and experiencing the system in the States really reaffirmed for me that that is something I want to spend a career supporting and enhancing. And I'm also very excited. I'm really excited to be home. Some of the other effects, so I feel like I've been tapped, if that makes sense to anybody. So I now have this fellowship, a very prestigious experience on my CV, and I've been able to leverage that to make me more competitive for some other awards, including things like CIHR funding. I've also had invitations to speak at policy events that are really above someone of my training, I feel, and I think it's just because I've now been kind of tapped as this person who can hold her own in a policy world, who's a great thinker, who has some new ideas, and I'm invited to this table that, quite frankly, without the Harkness experience, I think would have been inaccessible to me for probably another 10 years. I have connections in the States with really big names, so echoing Scott's story, I also had similar experiences when you're sitting in a room and you just think, like, I read your textbook in my PhD and now I'm sitting across the table having coffee with you, and that's amazing. So I have those connections, and they will continue to help me develop my research agenda and to help me have impact in all of the work that I do. And lastly, my husband and I shook our personal situation up big. So my husband quit his job to come down to San Francisco and support me and support the kids. And through that experience, both of us had very, very profound personal awareness around what we want to do for our family, where the joy in our life is. We were able to slow down and just think really critically about living our life and finding joy and happiness into it, as opposed to what it felt like before we left. We were kind of just surviving our life, getting our kids to and from school, and just kind of making it through a day to get up and do the next one. And I also have had a lot of development. So I invested throughout the year in building my leadership skills, and I have really felt that reflected now that I'm home. Again, with kind of being able to contribute to conversations in a different way, being invited to different tables, being involved in strategic development at the university here, and so just profound personal awareness and development for me over the year. So, as Scott said, I am more than, and I think I have one more slide. I do, yes. And just to kind of give you a flavor of the year, this is, I was in California as well, and so you'll see lots of fun pictures with the kids, and we had an amazing time exploring California and the States more generally. And also, you'll see in the middle there's a picture of the kids on the boat. As Scott said, the 4 of us in San Francisco just connected very, very deeply, and are 3 of our closest friends now. So happy to answer any questions.
Well, thanks so much to Fiona and Scott for your excellent presentations, both really about the nature of the program itself, but also the personal side of it, which is really important as people are thinking about potentially applying for the program. We really appreciate both your professional and personal reflections there. Before we open it up to questions, I'd just like to note that the deadline for receipt of applications from Canadian applicants for the Harkness Fellowship coming up is November the 16th, November 1-6. And you can find all the relevant information, including the application form, a Harkness brochure, as well as information on former Harkness Fellows on our website, cfhi-fcas.ca. Prior to this webinar, you would have also received some resources from us, which include a new Harkness promotional video that we just created here at CFHI, which features both Scott and Fiona, as well as links to relevant Harkness documents and presentations that can provide further information. If you did not receive these resources, we'll be resending them to you after the call. Now, if you have any questions about the application process itself or the fellowship program in general following this call, you can reach out to either myself, Stephen Samus, via CFHI, or to Robin Osborne, Vice President and Director for the International Program in Health Policy and Innovation at the Commonwealth Fund itself. And if I can't provide the information for you, Robin certainly can. So now we have a chance to take a few questions from people, and I see a question up here already from Karine. Saying, thank you for your great presentations. Based on your experience, would you say it is too late now to start preparing an application? So good question with, about 6 weeks to go. Who would, Scott or Fiona, either of you like to take that one?
I can start. So I would say that absolutely not. It's not too late to start thinking about an application. For myself, again, as an academic, one of the key pieces of documentation and support that I needed was sign-off from my university that if awarded, they would support a leave of absence for me. So just, thinking about the pieces of documentation that you might need, that for me was one piece that required a lot of meetings with, I had to meet with my department head and then my dean, and then it had to go up for sign-off for approval at the provost level. So there are pieces that do have a timeline that's a little bit outside of your control, so you'll certainly want to think about those and make sure that you do have the time you need to get that documentation together.
Yeah, I'll just add to that, I agree it's not too late to start, and a couple little tips. Like Fiona said, some parts are out of your control. Your reference letters are the other one, and one of mine came in on the last day, and that gets uploaded directly to the website for Harkness. So getting those organized and asking your sponsors to write those letters early is the thing I would start with. And then in terms of the actual application, I would say don't worry so much if your research proposal isn't perfect, because it's going to change throughout the year. It's important that you have that you've given some thought to what you want to research. And for me, a lot of the components, I took those from my grad school application and from some other types of biographical and application things that I'd written previously as starting points to give me some content to start with. So think about those as ways to start boosting the filling in the blanks of your applications. Use things you've previously written as a starting point to help think that through.
Thanks both. Related set of questions here from Vidi. Thanks for the excellent presentations. A quick question about the application process. What are the components that are required for submission by November 16th? And related to that, how does one propose the specific project? And is the fellow or the prospective fellow expected to contact the host institution, whether it be Stanford or Harvard, directly? Scott, do you want to start us off?
Yeah, so in terms of your project, your placement at an institution happens after your Harkness Award. You may have contacts at an organization where you're interested in going. I didn't. So I applied and I really had no idea where I wanted to go, and the Commonwealth Fund will help place you. They will tell you afterwards, they'll say, well, here are some places that are doing research that's related to what your area of interests are. Here are our contacts. Reach out to them, and then you negotiate your placement after that. So I wouldn't worry so much about that. If there is someone you know at an institution that you're interested in working with, you could certainly get in touch with them for ideas, but that's not necessary. In terms of all of the components that are required for submission, those are listed in the application package, and that is probably better answered by looking at there. Fiona, do you have anything else to add to that?
No, I mean, my experience was the same as Scott's, and quite frankly, like as a Canadian, I was incredibly naive about who I would work with and what project would actually be meaningful in the States. And so when I reflect now so I had pitched something around the idea of disinvestment, or we're calling it in Alberta, reassessment of technologies. So stopping doing things that you're already doing. And I read the proposal that I pitched now, and in the States, it's actually very easy. You just stop paying for things. They don't have this kind of catch-22 of needing to cover things that are medically necessary. So I think when you're thinking about your project, think about like what makes sense for you. What are you interested in? How does it build upon your CV? How does it map out to your future career plans and where you want to go? And how does it align to the Commonwealth areas of interest as well as CHFI? I would say those are the most important things. And then as Scott said, I did not have a placement in mind. So after I heard that I was successful, the Commonwealth Fund followed up with about 6 or 7 different possible placements for me. And I talked with all of them, and I talked with my husband about where he wanted to spend the year geographically. And we landed on California from that.
Great, thank you. That's really very helpful, I think, to people on the line today about how that placement actually comes about and what you need to do in advance of it. Fiona, I know you talked about your reflections when you got back to Canada and some of the ways in which your thinking had changed and the way you were re-energized. And Scott, you've talked about how your career is changing and the trajectory of your career is changing potentially now through some contacts that you've made. What would you say in general about the impact of the fellowship on career trajectories, both from your own experience but also what you've seen from others who have come through the program?
Scott, do you want to go first, or do you want me to?
Go ahead, Fiona.
Okay. So I feel that this fellowship has really launched me, I would say no joke, about 10 years forward in my career. So for me, I am deeply committed to an academic career. I love being on faculty, and I feel like it's a place where I can achieve impact. I love working with my students. I love my colleagues. Like, this is where I want to build my career. So, and I knew that before I went, and it reaffirmed for me that that's the right path for me in the rest of my career. Having said that, with an academic career, there's a progression that happens. So you start at assistant, you move up to associate, you move up to full professor. And so I do feel like everything has just been catapulted forward. And I have received some awards that I'm very proud of this year that I don't think I would have been competitive for without the Harkness experience. I've received invitations to speak and sit on panels that, I look around and most of the people on there are my mentors, not people I would have traditionally considered as my peers, but, people now see me as part of their peer group. In terms of my own thinking, it's really changed my approach to thinking about research, and I'm not interested in doing research for the sake of knowledge generation anymore. I'm interested in doing research to achieve impact. And so I'm always thinking about, I'm writing up my findings and I think, okay, so what? Like, who has to do what differently now as a result of this? And that's a new mindset for me. I'm also thinking about dabbling into, right now Canadian healthcare is in a time of crisis and a time of change, I think. And I'm trying to figure out how I can be a voice to influence healthcare in the direction that I believe it should go to come out kind of with the same principles. So universal, accessible, equitable, principles that I now believe more strongly in than I did before, and trying to figure out how we can maneuver our system to actually achieve those things in a more meaningful way for our society. So.
Scott, do you have a reflection on that?
Certainly, and for me, my background is nursing, and I worked in frontline nursing and worked all across the Arctic, and then moved into health policy. And I'd always sort of thought of my career as, sort of progressing along maybe along the administrative route of, being in a director role or maybe even in a CEO role in a health authority, and that's sort of where I thought that my opportunities would be. So what is really, my mind has really opened up to this year is just the expanse of opportunities that are out there. Even though I don't have a sense of exactly where I want to end up, right now there are a lot of opportunities that are really interesting and are allowing me to try out different areas that I would never have thought that I would be doing. I wouldn't have thought that I would be, staying embedded in a research team at Stanford University and and we're discussing the next steps of how do we disseminate this information, how do we do a pilot project with this information next, and what could my potential role be with that. So for me, it's been around exploring different opportunities and having the opportunity to explore those that I wouldn't have necessarily either been exposed to before or thought of before or really been considered for previously.
Great, thank you both. We're getting close to the end of our time, but I had one more question for both of you, if you could both just respond briefly to this. I mean, you've both talked about the mentoring component of the program, and it is a very, very important part of the program. And I know from my own experience working with, communicating with fellows over the years that there are some of those mentoring relationships are incredibly powerful, strong, and rich, and some a little less so. What do you see as the key components to that mentoring relationship, and how do you really make that relationship one that you, as a fellow, get the most out of and that's most meaningful for you? So, Fiona, could you start?
Sure. So for me, I have been privileged throughout my training to have mentors that are very honest with me, and sometimes I need a good kick up the pants. They're very transparent with me and very open. So, for me, my mentors have always been very willing to share both professional and personal experiences with me to help me learn and grow. And my mentors inspire me. So they're people that I would look up to as, role models that I could only ever hope to mimic. And so for me, when I was picking a mentor, I admit I did it a bit naively. Like I had a bunch of big names suggested to me by Robin and the Commonwealth Fund, and I very timidly approached them all and had phone calls with them all. And again, I spoke to my husband about where he wanted to be, and he did not want to be somewhere that had a lot of snow shoveling. So that shut down a few options right off the bat. And whilst that may sound very small and flaky, I guess, it was really important, and Scott already spoke about this, it was important to me that my husband was happy throughout the year, especially because I knew I would be traveling a lot and leaving him to fend for himself with the kids, which is a really big ask. And so it was very important to me that if he had things he absolutely wanted out of this year, that those were number one priority, and then I would work everything else around that. And then I talked with Dr. Redberg, who ended up being my mentor, and we just connected instantly. She is an amazing woman, and from the moment that we talked, I knew that was the person I wanted to work with. So that's how my experience was.
Thanks, Fiona. Scott, reflections on the mentoring relationship.
I was fortunate that I ended up with two mentors. I had a primary mentor, Dr. Arnold Milstein at Stanford University, and a co-mentor, Dr. Julie Schmidtdeal at Kaiser Permanente Division of Research. So I had the benefit of very different people with very different approaches and very different brains to talk to. My advice, and I wish I would have, and this is advice that was given to me by a previous year fellow, said make sure that you schedule time with your mentor. They're very busy people. They're very often in demand by a lot of people. They often have other fellows they're mentoring through other fellowship programs. And I was told, schedule a regular meeting with your mentor to check in at least once a month. And I didn't take that advice early on, and I should have done it right from the start. But when I started doing that, it made a huge difference. And even if we had nothing on the agenda, it was just, I would just say, tell me what else you're doing that's interesting, which would lead to other conversations. And then he would say, oh, well, you know what, you're interested in remote healthcare. I'm going to this meeting at the Artificial Intelligence Lab tomorrow where they're going to show me this new product that does facial recognition in seniors to reduce falls and improve dementia outcomes. And that could be something really interesting for you if if you wanted to deploy that in remote areas. So just having those even informal conversations was really important. And the other thing that we did is we had a policy forum about every 2 months where we brought all of our mentors together in the Bay Area with the fellows for dinner. And it was a chance for us to be a bit more social and for them to interact with each other as well as with us. And we got to benefit from each other's mentors. So my biggest piece of advice would be to schedule dedicated time with your mentor on a regular basis so that you are just talking about your project, about opportunities, and keeps you on their radar so that when other things come up that you might be interested in, you're the first person they come to with the idea.
Great, thank you. Well, I'd like to join some of our participants on the call today and thank you both for excellent presentations about the fellowship. I think people on the line hopefully have a much better sense and a richer sense of the fellowship and its transformational possibilities for people, both personally and career-wise. So for all of you on the line, we hope the session has been helpful in explaining the nature of the Harkness Fellowship and determining if it's going to be right for you. We would ask you to please take a moment to fill out the quick polling survey, which you're going to see now on your screen. This always helps provide useful information about where you see yourself in relation to the next steps provided about applying to the fellowship program, including if you would like further information from CFHI. And for those of you on the line, be sure to register for our next webinar on October 14th, very different from this one, but we will be kicking off our 3-part Data Bootcamp series. And for those of you interested in data and how to make it work for you, we welcome your participation in that free webinar as well. Thanks to our speakers again and to all of you for participating in the session and for the discussion. And this will conclude today's webinar. Thank you.